Good day, ma'am. I am Chris Madel Tayo, your nursing aide for today, and today I will going to demonstrate providing tracheostomy care. So, the purpose of this procedure is to maintain the airways patency, maintain cleanliness, and prevent infection of the tracheostomy site, and also to facilitate healing and prevent skin excoriation around the tracheostomy site, and also to promote comfort. So the um, the assessment, for the assessment, we are going to assist the client for um, respiratory status, including the ease of breathing, rate, depth, rhythm, lung sounds, and oxygen saturation level, the pulse rate, the character of the secretions that from tracheostomy site, the presence of drainage on the tracheostomy, dressing or uh, tie, then the appearance of the incision of tracheostomy. We need to note that the redness, um, the swelling, if there is, and the purulent discharge or the odor of the incision. So, next, identify the client. So, by identifying the client, we have two procedure, method. Um, as his name and also the hospital bracelet, the name, age, date, and where he is now. So afterwards, if the client is unconscious, we can ask the relatives present in the chart. That way, we can verify the client's identity so that we avoid the missed patient. So afterwards, determine the need for tracheostomy care. So we need to assist the client's pain and administer the pain medication before the tracheostomy care, or if indicated only. Then we are going to explain to the client what we are going to do and the reason why we are doing it to the client. So, sir, I am going to administer tracheostomy care for you so that we can remove the secretions of their ears and change the dressing for your uh, tracheostomy, and so that it will help you feel comfort and far away from the infection. So we need to explain to him even if he is not look alert. Also, we need to reassure him that uh, in the process of procedure, he can always interrupt me if he feels or experience respiratory difficulties, something like he cannot breathe or something he feels pain like that. So afterwards, perform hand hygiene. Then we need to adjust the bed to comfortable working position, and we need to lower the side rails closest to me if applicable, and the far side rails is still high position. Then afterwards, if the patient is conscious, we are going to assist the client in semi-Fowler's position. Mm, and if the client is unconscious, still in lateral position. So, excuse me, sir, I just uh, assist you in this semi-Fowler's position. I hope you can cooperate. Okay, thank you. Afterwards, afterwards, we are going to place my um, equipment at the bedside uh, of the patient. Uh, and uh, please proper receptacle within reach in my working area, so that it will uh, save time and effort for me during the procedure. So, and afterwards, for implementation, we need to put on face shield, goggles, and mask if applicable. Then suction or um, proceed to suctioning or tracheostomy care if needed. But if the client is done for suctioning, so we need to remove the soiled dressing and uh, put it in proper receptacle prior to remove the gloves using for suctioning. Then afterwards, in cleaning the tracheostomy and non-disposable inner cannula, first we need to prepare the supply or material. So prepare the tracheostomy kit care in the box. If it was applicable or available, we need to open it and separate in the basins. We need to make sure that we doesn't touch the inside, just at the edge, because it was sterile. Then afterwards, if there is no available, we need to open 3 more sterile basins and fill the one basin with 0.5 deep in hydrogen peroxide, and or 1/2 hydrogen peroxide and 1/2 saline. Then next, fill the 2 remaining basin with 0.5 deep in saline. Then afterwards, we need to fill open the sterile brush or pipe if not available at the sterile tracheostomy kit, and add additional with the sterile gauze pad. Then we have to put on disposable gloves. Then before proceed, I'm going to put this one into the client's chest, the rubber pad, so that if the secretions will excrete later, he is safe from soil or infection. So afterwards, we need to remove the oxygen device and remove the dressing also. Then stabilize the outer cannula and face plate. Then we're going to open this one counterclockwise, then remove, and we're going to clean this one using the saline, or we're going to put this one in saline or basin with saline and hydrogen peroxide. Then we're going to replace the oxygen source over the outer cannula. Then remove gloves. Nalalaglag siya. Then afterwards, clean the inner cannula as follows. So we need to use sterile gloves. So, ayun na nga. Nagulo na siya. And we need to remove this one again. And this one. Then, with the applicator, we need to clean. Then, we need to place loose pad slide at the faceplate. And next, we need to stabilize the outer cannula with one hand. Replace the cannula into the outer cannula. Then, we need to lock that one. Make sure that we are not only the outer part we are touching, not the inside, because it was sterile, or just to keep safe for the. And after that, we're going to apply the oxygen. Then, afterwards, applying cleaning dressing and ties tape. So, we're going to remove this one again. Then, we're going to dip the cotton field and remove the this one around. Touch the skin and pull gently. Afterwards, place this one with new one, but before that we need to pat it with those pad 4x4 before placing another one. We just need to slice it, and then after changing the we need to do the the tape and ties. We're going to remove this one gently. Make sure that if we tie this one, let have a space one finger so that it's not too tight. And it should be nice with, and we need to place back the oxygen device. Then the neck and ties are between the fingers, feet. It's good. And next, we are going to reapply the oxygen. So the oxygen is already applied. Then remove the face shield, goggles and mask if used. Then remove the gloves and perform hand hygiene. And for evaluation, we are going to reassess the patient's respiratory status, including saturation, oxygen saturation, respiratory rate, and the lung sound. So, sir, I'm going to assist you first before I leave. So, can you please deep breath? Deep breath. Again. Again. Oh, much better now than before. So, are you feel all right? That's good. Much better. Then, for documentation, we have to record the respiratory before and after the care, and the type and size of tracheostomy that we use. Also, the tube, the frequency and extent, the color, amount, and the tolerance of the patient to the procedure, and the special care that we don't expect, or unexpected outcomes. Then after that, we need to report the accidental decannulation and or respiratory distress that we encounter during the procedure, and report it to the healthcare provider that is present. Okay, that's all. Thank you.